Hey guys, and welcome back for our daily practice questions. As always, I like to get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I'm the founder and CEO of the Nursing Studio. I provide resources, tools, courses, review books, review videos, and more to assist nurses and nurse practitioners with success on boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success, and I would love to assist you if needed. I always get into my disclaimer and the reminder that we know there's no absolute in medicine. We treat on a patient by patient basis. And any other questions that you see that I have designed here are based on the guidelines that are currently being tested on the AANC, the ANCC, and the AANP exam. And any of the videos that you see that I am teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states the nurse practitioner and NP student are discussing the criteria for the diagnosis of type 2 diabetes. The nurse practitioner is explaining to the NP student that it only takes having one of the listed criteria to diagnose with type 2 diabetes. All of the following are criteria. Let's start from the top. The nurse practitioner and NP student are discussing the criteria for the diagnosis of type 2 diabetes. The nurse practitioner is explaining to the NP student that it only takes having one of the listed criteria to diagnose with type 2 diabetes. All of the following are criteria for the diagnosis of type 2 diabetes, except is it A, an A1C of 6.5% or greater? B, a fasting plasma glucose of 126 milligrams per deciliter. C, a 2-hour plasma glucose of 200 milligrams per deciliter. Or D, a random plasma glucose of 160 milligrams per deciliter. Take a moment and tell me what you got in the comments, you guys. All right, I always recommend reading the stem of the question first, so it allows you to slow down to ensure you're answering what is even being asked of you, right? So here, the stem of the question states, all of the following are criteria for the diagnosis of type 2 diabetes, except. Make sure you pay attention to those absolute terms like you're not, except, initial, best, all the things, so that you're not missing what they're truly asking you, right? So it says except, so we're looking for the one that is incorrect, right? So, there's criteria when you're diagnosing these patients with diabetes. And so when they have certain numbers and certain ranges, and they have at least one of those, we begin to think and we start to confirm our diagnosis, right? But one of these are incorrect. So an A1C of 6.5% or greater, that's correct. A fasting plasma glucose of 126 milligrams per deciliter, that's also correct. A 2-hour plasma glucose of 200 milligrams per deciliter. That's correct also. D, a random plasma glucose of 160 milligrams per deciliter. That's the incorrect one. That should also be 200. Your 2-hour plasma glucose and your random plasma glucose, if it is 200 milligrams per deciliter or greater, that is a positive, okay? Question number two. The nurse practitioner notes a systolic murmur at the apex of the heart. Based on these findings, what type of murmur should the nurse practitioner document? Is it A, mitral regurgitation, B, mitral stenosis, C, aortic regurgitation, or D, aortic stenosis? Take a moment and tell me what you got in the comments, you guys. All right, so the stem of the question states, based on these findings, what type of murmur should the nurse practitioner document? All right, so what do we have going on here? They said that they noted a systolic murmur at the apex of the heart. Y'all know I always tell y'all for the purposes of boards, make sure you know systolic versus diastolic and the location of mitral and aortic to be able to answer these questions, right? So again, I always say if you have a mnemonic that you follow for murmurs, follow that because there's tons of them. But the one that I always teach on, my Brittany's Brilliance, It's called sassy systolic because old systolic is so sassy that they say men really are stupid, right? So men really, MR being mitral regurgitation, are stupid aortic stenosis, right? All right, and then diastolic is the opposite, but here we're looking for systolic murmurs. So we know mitral regurg and aortic stenosis are systolic, so we know our answer is going to be either A or D, right? So we can eliminate B and C. And this is what I want you to do on boards. So you're not missing stuff that you know the answer to. Strike the answers out so you don't double back and miss it for whatever reason, thinking, oh, I remember I said it was mitral or whatever else. No, go ahead and eliminate it. And it sounds so minute and it sounds like Brittany, whatever. I'm not gonna miss something that small. But we do. We get under pressure, we get anxious, we're rushing, we skim, whatever, and we make those little small mistakes that cost us points. And we don't have time to lose points on things that we know for sure the answers of. So cross out the ones that are absolutely wrong so you're not making any careless errors, okay? So we know it can be either A or D for mitral regurgitation and aortic stenosis. Mitral regurgitation and aortic, so A and D, and then we can eliminate the B and C, right? So apex, what is located at the apex of the heart? So we have the base of the heart, the apex of the heart, right? Or they can say second intercostal space or fifth intercostal space. Remembering aortic is located at the second intercostal space at the base of the heart, and mitral is located at the fifth intercostal space at the apex of the heart, right? So this is apex, so it will be mitral. So your answer is A, mitral regurgitation is systolic, mitral, okay? And then lastly, question number 3, the nurse practitioner is explaining the cancer that leads to the most cancer deaths for men and women to the NP student. Which cancer is the appropriate cancer? Is it A, breast cancer, B, prostate cancer, C, lung cancer, or D, pancreatic cancer? Take a moment and tell me what you got in the comments. All right, the stem of the question states, which cancer is the most appropriate cancer? So what are we talking about here? The nurse practitioner is explaining to the NP student there is one particular cancer that is the one that leads to most cancer deaths in men and women. So this is one of those knowledge-based questions, but as you are reviewing, make sure you know these things. But the best answer is C, lung cancer. Lung cancer is the leading cause of cancer deaths in men and women, okay? All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Make sure you meet me back here. If you need any of the resources that I offer, feel free to reach out to the Nursing Studio at 803 400 6864. You can also shoot a text to this number or shoot us an email at the nursing studio, the number one, at gmail.com. I have review book options, either ebook or paperback. Both of those are linked in the bio of this channel. Also, there's a self-paced review course that is broken down by system for family and adult GERO, preparing for the AANP as well as ANCC exam. Um, you can watch the videos, do the mini quizzes associated with each video, and you can watch as many times as you like. That is also linked in the bio of this channel. I have an upcoming group 5-week review course starting on June the 10th. That's linked in the description of this video. And then the one-on-one sessions where there's multiple options that you can do. Either it's a weakness you just want to work on, if you want exam readiness assessment, or if you are looking to work with the custom package. That's the most common one, where you may have been unsuccessful before on boards and you're looking for someone to tell you, engage where your weaknesses are, help you to design a new study plan, and work alongside with you to go from unsuccessful to successful. But I always say with my one-on-one stuff, make sure you reach out so that we can gauge what you need, because it's really customized on what you're looking for, what needs to be done, and which plan will be best for you. So with that, just reach out either by calling 803 400 6864 or shoot us an email at the nursing studio 1 at gmail.com. As always, you guys, happy studying. Make sure you meet me back here. Bye, y'all.